After I assess the patient's mouth, I would just move down to their neck area, and knowing that she's a college student, maybe sometimes I would be assessing her tonsils, and I'd maybe be able to palpate them or even inspect that they're swollen, and because you can sometimes kind of see like that mass area. And sometimes you are required to assess the thyroid, in which you would come from the back and you would be able to palpate this way. Next, while you were maybe giving your patient a bath, that would be a great time to look over the body and assess for any skin abnormalities. You look at temperature, integrity, any lesions. You want to know if something was there before. Sometimes they develop like pressure ulcers or wounds from being in the hospital. So that's something you look at with the skin. Next, I would move to the respiratory system, and when I inspect that, I'd be using my stethoscope to auscultate the lungs, but I can also ask the patient some questions like, have you had a cough? Are you producing anything when you're coughing? And then they might know the characteristics of what they cough up, or I might have to collect it myself while they're staying in the hospital. So if I were to listen to her lungs, I use the stethoscope and I would place the bell on one side, and I would tell the patient to breathe in through their nose and out through their mouth. And then I just move in an organized pattern. I just move back and forth. And then sometimes I personally feel like I can hear better from a posterior position, so I usually have my patient lean forward because I just feel like the lung sounds are a lot clearer. So I would do the same way, do it in an organized pattern. And then that way I'm able to assess each of the lobes on both sides of her body, and I can tell if she has different types of conditions, like if she's got crackles or wheezes, any abnormal findings like that. It helps us figure out what condition she's having. And lastly, in the upper body, part of our assessments at the hospital include like the musculoskeletal part. So when it comes to like the upper extremities, one of the things I would include is range of motion. So sometimes I have to ask the patients if they've ever had like a shoulder operation, and then sometimes patients can't raise their arms up very high, or they can't really put their hoodies on or their sweatshirts or whatever they're wearing. So sometimes they can verbally say it, but sometimes they don't even know that their shoulder doesn't move very well until we go to do exercises with them or when I assess them. Another thing with their upper extremities would be, like I said earlier, the skin, but I'm also assessing their circulation in their arms. So I can look at their veins, and sometimes if I can't see them as well as I normally can, that might be due to dehydration, or if they're anemic at that point, that can affect how well you can inspect their veins or things like that. And then I also look at their color in their fingers, because sometimes depending on what condition they don't have the best circulation to their extremities, such as their hands or feet, and so their fingers will kind of be like dusky and blue looking. And when I check their cap refill by squeezing their fingers, it takes longer than 3 seconds because the blood isn't flowing as well as it should be. I also check their pulses in their arms. When it's a baby, I usually check their brachial pulse because you can't feel their radial as well. And I would include vital signs in their upper body assessment. So usually they require us to check their apical pulse with our stethoscope. Like today I checked someone and they had an irregular pulse, so we had to document that and let the doctor know. The other things with vital signs is we'd be using a blood pressure machine, and we would be using a pulse ox, which you put on their finger, and that tells you their oxygenation levels. The way you could assess the heart with the stethoscope is you'd also be placing the stethoscope, and you'd be on their left side, of course, and depending on what part of the heart you would want to listen to, there's different places you could focus on, whether it's like the fifth intercostal space or the third or whatever. You just have to know if you're doing that focus of assessment, which part of the heart you need to assess. Lastly, since Sarah is a